So recently a client, new client, reached out to me and he said, Gary, I've only recently understood how much I'm writing off to insurance. Thanks to your help. I've only recently understood what I'm writing off. I didn't know before. And now I know. And now I started looking at what my reimbursements are when I look at EOBs from PPO plans. And one particular Delta plan, now not all Delta plans are the same. An employer can work with any insurance company to write the plan pretty much any way they want. And if they're willing to pay a higher premiums for the employees, then they can design a better benefit plan. And if they're stingy and don't want to provide much in the way of benefits, then they can write a really lousy plan, which is what many employers do. And he said, I have one, Gary. He said, I'm now paying an average of $75 an hour to my hygienist. And that's just the reality of it today. He's in Orange County, California. So that's what it takes to hire. So if I don't offer that to someone interviewing, they'll go to the next interview and get that offer from the next office. And he said, I have a plan that's paying $57 total for an adult hygiene visit. That's hygiene, exams, and x-rays. Naren, you don't need to be a math major to figure out that he's losing money. He's losing money just on the hourly rate.
Yes. He's
let
not
alone
about the rent and all the other expenses.
Forget about the room, forget about the equipment, forget about the materials that are used, the infection control that you go through to make the room a safe environment for your patients. Forget about the admin expense that you're paying an admin team member to put a butt in the seat in hygiene. He said, I can't do that anymore. I'm losing money. So he was busy. And we're early in the game with him, and he's still busy losing money, but he knows it now. And we are developing a very specific strategy to exit that, to drop these plans successfully, because it's not viable. He quite literally would be better off financially. He'd be better off not having a hygiene department. And that is a disaster, my friends. Those of you that know me know that I am passionate about creating a hygiene-driven practice. And the idea of not having hygiene in your practice would really be a step in the wrong direction. Not only financially for your practice, but for the betterment of your patients. We know if we see your patients professionally on a regular basis, we accomplish two things. We reduce we keep them as healthy as possible, and we reduce their future dental expenses because we're able to identify concerns at the earliest stage. And there's a corollary, Naren, you've heard me talk about. The more hygiene activity we have, the more productive the doctor's schedule is. There's a direct one-to-one correlation because those hygiene exams are an opportunity to cultivate more treatment, more necessary or desired treatment from your patients. And a lot of times the high value dentistry that doctors do, things like adult ortho and smile designs and complex restorative dentistry, dental implants. A lot of times those are presented to patients, but for whatever reason, the timing isn't right in their life to move forward. Maybe they have kids in college and the tuition bill is draining the bank account, or maybe they, had some unexpected expenses, had to put a new roof on the house. And so when we keep them in hygiene and they keep coming, whatever their recall frequency is, whether it's 3, 4, or 6 months, most likely 6. And then we have a chance to talk to them about their unscheduled treatment and just kind of check in with them and say, hey, what are you thinking about, having that implant done to replace the missing tooth? Very often, timing changes and now they're ready to move forward. But by keeping them in the hygiene department, you keep them as an active patient in your practice. And when they're ready, you're ready to do that high value dentistry. So not having any of that happening would be a disaster in a practice. And yet I can't condone, what this doctor was experiencing in Orange County, where every hygiene patient, he's literally, it's almost like he's cut an artery. He's bleeding to death on every one of those hygiene appointments. Now, Naren, the reason why most dentists don't know what they're writing off, they don't know it, is because there's 2 ways to enter your fees into your practice management software, and both of them are accepted accounting protocols. Either way is allowed. One way is to enter your UCR fees, your usual, customary, and reasonable fees, and you enter those in. And you populate your fee schedules with your UCR fees. And then when you get an EOB from the insurance company, you load that into your software, whether it be Dentrix, EagleSoft, Open Dental, And then the computer does the heavy lifting of the math to figure out how much you write off. And if you do it that way, you could then run an insurance adjustment report and see what you are writing off by any time frame you want, daily, weekly, monthly, annually. You could see a report with hard numbers with what you write off. But here's the fact that many of our listeners don't know. Only 10% of the dentists in the United States enter their UCR fee schedule that way. The other 90%, a massively bigger group, do it the other way.